let us go over the side effects of a very commonly prescribed antipsychotic drug, aripiprazole, most commonly known by the brand name Abilify. We'll be going through the sort of side effects which you might experience when taking Abilify, as well as the potential dangers of being on the drug. We'll also be looking at how significant these dangers are for you, as a patient taking the drug. Please watch the video until the end, as this drug is quite dangerous, and there's some important things that you should be aware of. We're going to start with very common side effects. These occur in over 10% of the population. So if you have 100 people taking the drug, more than 10 of them are expected to experience at least one of these. They're very common and tend to be quite minor. Very common side effects include things such as drooling, increased appetite, weight gain, so there is a considerable likelihood of putting on weight while on Abilify, insomnia, which is difficulty going to and staying asleep, headaches, nausea and vomiting, lightheadedness and dizziness, constipation, increased anxiety and increased agitation, discomfort and other feelings of abnormality. Finally, a general sense of unease and restlessness known medically as akathisia, where the patient has to keep moving in order to feel more comfortable. Akathisia is a common side effect of many antipsychotic drugs, Abilify included. These side effects are typically not dangerous. However, if you find that they're affecting you significantly, please do talk to your healthcare provider regarding them. It is normal for you to experience one or more of these side effects while taking the drug, although it is completely normal if you experience many of them, all of them, or none of them at all. Moving on, we also have common side effects of Abilify, which have a 1 to 10% incidence in the general population. So, out of 100 people taking the drug, 1 up to 10 people are expected to experience at least one of these side effects. These are a bit more unlikely, and tend to be more serious. They include tremor. This is the involuntary shaking of certain parts of your body, usually your hands. Indigestion. As a patient, you might experience this as irritation or pain in your stomach. Sleepiness. Feeling drowsy or sleepy throughout the day is a common side effect of the drug. Coming with this is feelings of fatigue, where you also feel tired or exhausted because of the drug. Dry mouth. Visual disturbances, including symptoms such as blurred vision, coughing, stiff muscles. This can decrease your range of motion and make everyday tasks more difficult. General pain in different parts of your body, mostly characterized by muscle pain. Rashes, red patches on your skin which could be very itchy. Rhinitis. This is inflammation of the mucous membranes of the nose which could lead to cold-like symptoms such as blocked nose and nasal congestion. Head rushes. To avoid this, it is recommended that while on Abilify, you should get up slowly and carefully. Again, as before, you should be talking to your doctor regarding these side effects, especially if they become severe or debilitating. Next, we're going to talk about the uncommon side effects of Abilify. Uncommon side effects affect only 0.1 to 1% of the general population. So, out of 100 people, less than one person is expected to experience these. However, they do occur, and you should immediately talk to your doctor if you experience any of them. Uncommon side effects include diarrhea, bradycardia, or slower than normal heartbeat, or tachycardia, characterized by a heartbeat that is faster than usual. Heart palpitations. This is characterized by feelings of heart pounding, heart fluttering, or heart beating too fast. You may also experience heartburn. This is characterized by a burning sensation in your chest. It usually isn't dangerous but can be very uncomfortable. Other uncommon side effects include dry eyes, photophobia, which is increased sensitivity of the eyes to light, photopsia, which is seeing flashes of light, double vision, swelling in certain parts of your body such as swollen eyelids, tongue or face, difficulty swallowing. Swallowing can be made worse by the swelling. Developing speech problems. Gastritis. This is inflammation of the stomach lining, which can cause severe abdominal pain. Esophagitis. This is inflammation of the esophagus, causing a burning sensation in your chest. Numbness. Chills. Decreased mobility. Fever. Urinating more. You might also be getting up in the night to use the bathroom more often than usual. Decreased urination, or incontinence. Different forms of sexual dysfunction, such as erectile dysfunction. The drug can also affect menstrual cycles in females. It can delay, or completely stop periods. You might get urticaria, or hives. This is an outbreak of itchy rashes which can be very uncomfortable and quite dangerous. While on the drug, you might get suicidal thoughts and temptations of self-mutilation, particularly for patients with suicidal tendencies, or a history of self-harm. You might also develop a condition known as gait disturbance. This is characterized by a deviation from and difficulty with normal walking. Blood glucose levels can increase. This can cause you to develop diabetes, or if you're diabetic, the drug can worsen your condition, and even lead to a diabetic coma. So if you're a diabetic, you should be monitoring your blood glucose levels more closely while on Abilify. As before, you should always speak to your doctor regarding these side effects. Finally, we have rare side effects that occur in less than 0.1% of the population. Therefore, less than 1 person in 1,000 people are expected to experience these while on Abilify. It is very unlikely that you'll encounter one of these side effects, but they have been observed in patients as a result of taking the drug. Please, immediately get medical attention if you experience any of these while on the drug. Rare side effects of Abilify include seizures, rhabdomyolysis. This is the breakdown of muscle tissue and is a very serious condition. Lowered immunity, making you more susceptible to getting infections. Angina, which is chest pain due to heart disease. Cardiac arrest or heart attacks, particularly for patients with a history of heart disease. Blood clots. Stroke. Pancreatitis. This is inflammation of the pancreas. Hepatitis, the inflammation of the liver. Sustained or painful erections, medically known as priapism. Diabetic ketoacidosis. Raised blood pressure. A pharyngeal spasm, which is characterized by lumps in the throat. Laryngospasm, which is the uncontrolled contraction of vocal folds. Jaundice, a condition which causes a yellow discoloration of your skin or eyes. Hair loss. Increased body temperature. Tardive dyskinesia. This is a movement disorder characterized by involuntary, repetitive body movements. This is usually permanent and is an extremely dangerous medical condition. Neuroleptic malignant syndrome. This is a life-threatening condition which leads to fever, muscle rigidity, and neurological problems. There is also evidence to suggest that taking the drug can lead to memory loss and impaired judgment. These are generally all the side effects which you can expect when taking the drug. However, please note that the long-term side effects of the drug are not yet properly understood. Additionally, sudden, unexplained coma, or death, has been linked to the use of Abilify. The incidence of these side effects vary greatly from person to person. More dangerous side effects are usually more common in patients with more severe conditions, and also depend on factors such as your age, other drugs you're taking, and the general state of your health. For example, if you're diabetic, you're more likely to experience the sugar-related side effects of Abilify than a non-diabetic. It is important to remember that many of the side effects mentioned are unlikely to happen to you. If you have been prescribed this drug, it is likely that your doctor has felt that its potential benefits outweigh the risks. For many people, Abilify has been extremely effective in helping them deal with their conditions. However, if you do experience any side effect which you feel is severe or debilitating, stop using the drug and get medical attention as soon as possible. You can discuss with your healthcare provider regarding possibly decreasing your dosage, or finding other alternatives to the drug. There is still ongoing research onto the side effects of the drug, so this is by no means a complete list of the side effects of Abilify. If you're taking, or planning to take Abilify, it is strongly recommended that you watch our other videos for more information. It is always best to learn as much as possible about your drug. Stay safe.